Hi, I promised I would come back sometime this week and talk to y'all a little bit more about corrective exercise for your lower back. And so I've been trying to figure out just exactly how to put this together for you. I know a lot of people have lower back pain, and the reason it's taken me so long to do a series on lower back is there's so many, it's so complicated to fix. Now, it's not hard to fix, it's just complicated. And one of the reasons it's complicated is because you do different things on different sides of your body for certain movement dysfunctions. So it's very important that you know what your movement dysfunction is. Now, I told you in a previous video that there are basically 4 things that can go wrong with your back. You can have an anterior pelvic tilt, you have a real bad arch in your back. You can have a posterior tilt, so your back is rounded. You can have a shift to the right or a shift to the left. So you need to see what is happening, and how you figure that out is actually during a movement assessment. And so how I'm going to put this series together is I'm going to go through those 4 things individually and the corrective exercise for each one of the 4 things. So if you had, for instance, an anterior pelvic tilt, when you squatted from the side, you would go back like this and your back would arch. That would be an anterior pelvic tilt. So you have tight hips, you have tight lats, and you have weak glutes and core. If you had a posterior pelvic tilt, like you went like this, when you went your squat like this, your back would round like this. It's hard for me to do because I'm kind of opposite. And then if you had a shift to the left from the back, what that would look like is you would go like this and your body would move over to the left. And when you're shifting to the left, you have a tight IT band on your left side. You have a tight inner thigh on your left side. You have the back side of your right leg is tight. So all the way down there. And then if you have a shift to the right, it looks like this from the back. You go down like this and you kind of angle to the thing. And like I said, you can have combinations of two of those things happening at the same time. So it's very important that you have an assessment, a movement assessment. If you want to reach out to me, I can do those on Zoom pretty quickly. It's not too terribly difficult. Some of you may already know what you have or suspect what you have. I also mentioned to you some of the things that we have for knees we're going to be dealing with, or for lower back, are also going to help with your knees. For instance, if you have bad knees, you probably have IT band issues, you probably have inner thigh issues. So kind of keep watching along, because we might fix your knees before we even get to the series on knees. So I just kind of wanted to impress upon that. Also wanted to say, like, back to the knees. When I was a little girl, I had knock knees and pigeon-toed. So like my knees were like this, and then my back arched. So it's kind of like this. And so my knees hurt and my back hurt. And then through exercise, I have lengthened the muscles that are tight and strengthened the muscles that are weak, so my knees don't hurt and my back doesn't hurt. And those are all kind of things I'm going to be teaching you with this. So the first segment we're going to do, I'm going to walk you through the 4 steps of correcting for an anterior pelvic tilt. So if you notice that your back arches like this, then that's going to be an anterior pelvic tilt. The second segment we'll do with a posterior pelvic tilt, which would be this way. And then the third will be a asymmetrical weight shift to the left. And then the fourth will be an asymmetrical weight shift to the right. And like I said, you may have more than one of those things going on, but if you want to, in the next few days, reach out to me and, do a movement assessment, and then you can kind of see what you're doing. I'm going to come to you tomorrow or the next day, and we're going to start with foam rolling the things that we need to foam roll for our anterior pelvic tilt. Have a fantastic evening. See you soon.